You're listening to the Conference Board of Canada's Mental Health and COVID-19 series with Dr. Bill Howatt, Chief of Research, Workplace Productivity.
Hi, Bill Howatt, Mental Health COVID-19, Conference Board of Canada, back with you. I cannot believe it. It's week 4. And I know the next couple of weeks, the 2 weeks, 4 weeks are going to be challenging, and you keep hearing this about the news. And today what I want to focus on is healthcare resiliency. I want us to be able to continue to build on all the great energy and support for our healthcare workers in our country. And I want us to be very clear there's a role that we all play to support for all of us to get through the next few weeks. And one of the things I'm going to be talking to you about healthcare resiliency is to start to get some of the awareness of what's really happening. Yes, the data, if you look at Worldometer today, as I sit here now, there's been 280 people in our country who have lost sadly to this disease. We have over 15,000 people that are being reported. And what you'll realize is there's only been 3,000 people who've been reported who got through this. What does that mean? It doesn't mean that we should be just focusing on all the people that are dying. We should be paying attention to there's approximately 12,000 people that have this condition, and they're not all in the hospital. However, that means there's 12,000 people that somewhere in the system's watching, pay attention to their level of care, whether they're being taken care of remotely or being monitored or being in a hospital or being supported by the medical system. There's a drain happening to our system. And if it, as a surge continues to come over the next couple of weeks, and as the social distancing continues to be able to evolve, hopefully what's happening is as a society, we're flattening or crushing this curve so that we can get through this together. For me, healthcare resiliency, the mnemonic I'm going to use today is HELP. H-E-L-P, HELP. When I talk about the H, what I want to focus on to start with is honor. Honor the government's requirements, asks, expectations more than you ever perhaps have, and influence the people you can to take this stuff serious. We now are starting to realize if you start to pay attention to different countries like Czechoslovakia and etc., we're starting to realize there are stories out there around how social distancing, how washing hands, how putting a mask on when you're outside, making sure we're paying super attention to what we're doing so that every one of us are aware we're not getting people sick. We're not getting sick because by us taking care of ourselves and other people, we're actually lowering the drain. We're actually adding some capacity to our medical system. So the honor, the requirements is critical right now. Let's help our healthcare support. Let's care for our doctors, nurses, paramedics, police, fire, etc. by taking some of the pressure off, by paying attention and getting really serious over the next couple of weeks. It's a 14-day delay, so people that may or may not know that you're sick might have got sick 4, 5, 6, 7, 8 days ago, and you may be now sick and your symptoms haven't started to show. So let's take this stuff really serious. E, encourage recognition. I love seeing what's happening. You see in Italy, people are singing. You see in Windsor, people with fire trucks, and New York, and people are doing things. We may not have fire trucks, we may not have alarms, but in your own mind, think if there's different ways to send acknowledgement, or whether through a board post, or whether it's writing letters, or sending tweeters, or whatever they call that social media stuff, is to start to be figuring out how can we all appreciate, take a moment a day perhaps, and as a family, and sit and acknowledge and pray and be grateful for all these people in regardless if you're religious or not religious. My belief systems right now is throwing good energy to these folks, and good intention will be helpful, and it's good for us to be supporting these people at this point in time. So let's help them know that we care deeply and we appreciate deeply all their efforts for what they're doing. The L. Learn how you can support. There's all kinds of websites that are coming out. Every province has different support websites where they're asking questions on how to help find supplies. Like, do you know a cousin or an uncle or a friend that might have different access to different supplies? We need to get as many supplies as possible and help the government get supplies to the front line. We're fighting a war. It's an invisible war. Our frontline first responders, our healthcare workers are going to war every day with an invisible enemy, and you'll hear people talk about this And it's amazing they're putting their life, they're putting themselves at risk for getting what are called increased viral loads that put them at more at risk of getting sick. And so we need them to have the PPE equipment they can. So start reading and thinking and trying to figure out how can you contribute. Lots of us that are home now, if you have time, through our social connections, human beings, we're super innovative. Let's work together to figure out what we can do to help. And again, checking the federal government websites, your provincial websites, Ontario government, for example, calls for action, find out what we can do to be supporting and helping get. So if you know people that have PPEs or have different pieces of equipment that could be helpful, contact and inform people. Let's all start leaning into this. And the P, promoting prevention. Now, what's interesting, this is a wonderful opportunity for small businesses and for us to be starting to educate people on how we're taking care of the supply chain to ensure that we're not spreading the COVID-19. So if you're ordering a pizza, for example, or some food, there'd be wonderful organizations, small businesses, start educating people on your protocols that you're using to ensure. Like, for example, when I went to the grocery store this week, the difference was they had us in lines. There was lineups. I had my rubber gloves on. They signed me in, and I was walking in. They squirted my hands and asked me to rub my hands. So now I had product on my hands. I had this. So I'm thinking about my thinking is how can we all start becoming more aware and start sharing different risk protocols? Like, for example, I was learning the other day, I was washing my hands this way, and I didn't really know about that thing. And I was getting my thumb, but I wasn't doing this. So as promoting prevention is starting to share tips that we can be actually helping on regards to not only washing your hands, not only how to, if you're going outside, and is start perhaps wearing sunglasses. Keep those hands away from your eyes. You're going outside, put a scarf on. We want people over the next couple of weeks only to be going to where they need to and being careful of it and maximizing the opportunity to take the load and the drain off. Keep in mind, this is not just about the people that are dying. This is about the people the healthcare system is trying to keep alive. And what we need to do is continue to be mindful of this. And I would rather us have a huge success than a huge drain on our system. And this will be our new norm until they have this virus figured out and they have a cure for this virus. This will be the next few weeks till we get it under control. And then we'll start to figure out and learn together how we can coexist with this invisible monster while we learn how to tame it. Because what's happening is it is actually creating issues. But again, remember, the majority of us that get this will be fine. However, we want that 20% that get sick and start their experience with it. Let's take this really, really serious. And the most important part of this conversation today, it's a new week, week 4. Let's all add capacity to the system by paying bloody good attention, the best we can, to what we each individually can do to help. Let's help our healthcare workers this week win this war. With that, I'm excited about this week. I'm feeling optimistic about this week. I know there's going to be all kinds of hardship, but we together, by being optimistic and putting energy, let's help the people around us that are having a harder time with this, and let's together get through this. As a crisis, we'll help build us stronger as a community, and we will get through this one day at a time. With that, I'll see you tomorrow. Take care. Hi, Bill Howatt here. Hopefully you're finding these videos of some value. If you'd like to share these, on the lower right of your video, there's a icon you can click. You can send it through your social media feeds. Join the Conference Board of Canada social media feed so we can keep you up to date. And if you have ideas, suggestions, please leave your comments so we can consider them. If you have things that you'd like us to speak to or talk to, I certainly will try to do all I can to help out. So with that, have a wonderful day.